Good morning. I'm Heather Ladage, Market President and Publisher at the Austin Business Journal. And I want to thank you for joining us today for this important discussion on mental health in the workplace. In the last year, mental health has become one of the most talked about challenges for Central Texas workers and their employers and employees. Even with brighter days ahead, the mental crisis is unfortunately here to stay, and how employers support their employees will become more important than ever. In late March, American City Business Journals, our parent company, conducted a survey to gauge stress levels among readers, which will be helpful data for business leaders considering a wide range of business questions around remote work, work-life balance, and more. And it turns out that Business Journal readers are actually pretty resilient, a pretty resilient bunch. Well north of 80% said they're satisfied with their jobs and motivated to do their best for their employers. And the majority said their workplace stress has actually been fairly unchanged since the COVID pandemic sent much of corporate America working back from the corporate offices of downtown to back to their homes and dining rooms and kitchen counters and tricked out garages. But the average Business Journal reader isn't your average worker. They're relatively more established in their careers, and their home workspaces are more likely than not to be equipped with creature comforts and state-of-the-art gadgets. So in short, they've been pretty well situated for most of the coronavirus scare, which is not to say workplace stress has been on the decline amid the pandemic. Quite the opposite. In fact, only it depends on who you ask. For example, women were far more likely than men to identify a host of COVID-19 related factors negatively affecting their jobs, as were employees at large companies versus peers at small and medium-sized businesses. So we're going to dive into all of this today, plus learn what you can do for your employees and yourselves as we move forward. Please note that the chat section is available on the right side of your screen and is open for questions, and I'll try to work some of those into our conversation today if we have time. We have only an hour together, and I'd like to thank our virtual panel. Please welcome Dr. Mark Malone, founder of Advanced Pain Care.
Good morning, Heather. Can you hear me?
Good morning. We can hear you.
Awesome. Well, thank you for having me.
Yeah, glad you're here. Dr. Nahal Delpasand, founder of Respire Consulting. Oh, we can't hear you, but we can see you. Fabulous.
There we go.
There we go. Welcome this morning. And then also, finally, Dr. Ben Kurian, Executive Medical Director of HCSC.
Good morning. Thank you guys for having me.
Good morning. I'm glad you all could be here and focus on this important topic. We were talking before in the virtual green room, that's always been important, but we've seen maybe a silver lining of all of this pandemic situation is it's much more at the forefront of employers' minds as we especially go back into. So to get started today, I'd like to have, I'm going to go around and just want each of you to take a couple of minutes and tell us about your company and your role in the health and wellness space. And then we'll get into questions, all right? So I'm going to start with you, Dr. Malone.
Well, hello. Thank you, Heather, for having me. I'm Dr. Mark Malone. I'm the founder and president of Advanced Pain Care. We are a 25-physician, multi-specialty group that deals in 6 specialties, including pain, orthopedics, neurosurgery, rheumatology, addictionology, and behavioral health. We have 12 locations across Central Texas. One of our biggest focuses is pain management, and pain management is hand in hand with mental health. Many of our patients suffer from depression, anxiety, and one of our most important departments is behavioral health, which is staffed by 5 LCSWs, licensed certified social workers. And they provide individual counseling and testing. We test all of our patients for depression, anxiety, and other mental illness. and many of them have some readings on many of those scales. We provide counseling and addictionology services, and I can tell you this pandemic has impacted many of our patients negatively by increasing their degree of isolation and suffering to some degree. The most severe pain patients are affected the most severely. So having said that, yeah, it affected us tremendously. The staff is a different story. We have 500 employees, and most of them are continuing to come to work physically. And in fact, most of the patients come to work physically as well. I mean, come to see us physically. We're really kind of gratified to see that our patients want to see us in person as much as possible. When the pandemic first came out, I was afraid that many people might see what we do as a luxury service or not essential, but it really is essential. People in chronic pain can't skip a month seeing their pain doctor and pain nurses. So almost all, in spite of being able to do telemedicine, most all of our patients prefer to come in person.
Thank you. Dr. Delpason.
I am a licensed psychologist here in Central Texas. I have been in private practice for approximately 5.5 years, and I provide a wide variety of mental health services to most people in the lifespans, you know, starting from adolescents, young adults, and all the way up to, you know, elderly adults. In addition to providing mental health services in private practice, I have also expanded my practice to include Respire consulting. This came from a need that I actually really came to understand through working with my patients in the corporate realm. You know, during the pandemic, so many of my patients in the corporate realm were really concerned about the organizational changes that were happening, the initial shock, the initial, you know, worry, what's going to happen, how are we going to adapt? And so it was really important for me to extend my reach. I wanted not only to be accessible to patients from a clinical side, I also wanted to help with restructuring, organizational shifts within a variety of different domains. And currently, you know, different from Dr. Malone, my practice is all telehealth. And, you know, what I have observed is that this accessibility that I am now offered with doing virtual work is exponential for patients who, you know, otherwise could not see me in office. I now have the capacity to see people not only in the state of Texas, but the American Psychological Association has now implemented what's called Psych Pact, which is a mobility license that, because of COVID, allows for reciprocity in a variety of states. Not every state currently is participating, but I have reciprocity now with 15 states, meaning that I, as a psychologist, can provide care to people who are not just obviously residing in Texas. And this also is applicable for corporate coaching, for the things that I'm doing within the corporate realm. So I'm really excited to be able to do that. And again, you know, as COVID has been challenging, there's also been so much tremendous growth and change in our field. And I'm really excited about being a part of it.
Thank you. Welcome. All right, Dr. Kurian.
Thank you. Hi, my name is Ben Curry, I'm a psychiatrist that works in the behavioral health department at Blue Cross Blue Shield of Texas. You guys may know Blue Cross Blue Shield of Texas is one of 5 Blues plans owned by our parent company, Healthcare Service Corporation, which is the 4th largest insurer in the nation, covering over 16 million members and lives. In Texas, we're the largest insurer, and we cover over 6 million Texans, and we are in all 254 Texas counties. Myself, as I mentioned, I'm a psychiatrist. I work on a team called the Risk Identification and Outreach Team. The goal of that team is to try to identify some of our members that may have more complex behavioral health and medical problems and may be undiagnosed or undertreated, and try to reach out to them and provide case management and get them the right care that they need at the right time.
Thank you. Thanks for joining us.
Thank you.
So we've all been reading, or if not experiencing, right, the impact of the pandemic and what it's had on our mental health and our employees. Can you give a general sense of what the impact has looked like over the past year, what you've seen, what you're hearing from your patients and clients?
I would say from my clinical vantage point, I am definitely seeing an uptick in anxiety, in depression, in the challenge that has been presented in not having, a separation between where you work and home, right? Not having that distinction has been challenging because everything is happening for a lot of people still in one space. And so we also have to consider isolation. We have to consider the lack, for many people, the lack of mobility. Pre-COVID, we're used to getting up and leaving home and going to work and, doing quite a bit of activities. And so now, a lot of that has shifted, although things are opening up. That had a significant impact. Things that I saw an uptick in addiction. Social support is the cornerstone as a protective factor for my patients who historically have struggled with addiction or significant depression. And so if that is taken out of the equation, it makes it that much more challenging. So these are just some of the things that I have become aware of.
Yeah. We've seen an uptick in addiction problems here at Advanced Pain Care as well. And it's worse in the most isolated cases, the patients who can't get out, the patients who live alone, the patients who struggle with transportation. Addiction is very isolating, and it is aggravated by being isolated. So these are the patients most at risk, and we try to reach out to them. We provide ride services for them if they need to get a ride to come in to see us, or to go to medical testing, like if they need imaging or laboratory work. And these patients benefit tremendously by seeing us in person if possible. If not possible, then telemedicine. We absolutely have to see them at least once a month. But yeah, it's been a challenge in the world of addiction medicine.
I'll echo what both Dr. Delpason and Dr. Malone just said. From a payer standpoint, we've seen a tremendous increase in behavioral health, telehealth utilization, both for addiction and both for depression and anxiety. And I think the telehealth aspect is one that is probably the biggest trend that we've seen in the last year. Huge increase in the telehealth visits. We've been offering telehealth services for our members for years, but when the pandemic hit and doctors' offices were closed, we were able to quickly pivot to offer virtual platforms for our members and our providers. In addition, we're trying to work with our providers to help them use the platform of their choice for their telehealth visits rather than require a specific vendor platform.
Right.
I've been reading over the past year, like, that there's a shortage of therapists, and about therapists becoming burnout. And I would imagine the telehealth piece would help a bit with that, but can any of you speak to that? Maybe Dr. Delpason?
I mean, I think, Heather, you're absolutely right. There is a shortage because there's an extensive need, right? The need outweighs the the people who are providing care. One of the reasons, again, why the APA, American Psychological Association, implemented Psych Pact was exactly that, to provide more accessibility, to allow clinicians to not have to go through the tedious process of applying for licenses in every state. So with this mobility license, because it's not as tedious for me to go through and have to get, additional licenses, I can provide the care. I am now accessible to people who don't just reside in Texas, and I'm able to extend my reach. And so I think that that was a very smart decision. The other thing too is COVID hit. What APA did was remove some of the HIPAA barriers, because initially, FaceTime, things like Zoom are not HIPAA compliant, but because of the crisis situation and because of the extensive need, they removed those barriers so that we could treat our patients. So I would say I'm very optimistic about the growth that's happening and about more clinicians being able to reach patients. The other thing is that there are many other modalities. I mean, there's something called Talkspace. A lot of apps now are mental health focused. So if you can't meet with a provider, meet with a clinician, there are alternative ways to get support.
Dr. Deltason, I have a question. Are you in touch with the suicide rate? Do you see more suicides or attempted suicides because of the pandemic?
Yes. And I will say this, as I was saying, I work with people from across the lifespan. In my adolescent to young adult population, there has been an extensive increase in suicidal ideation, in hospitalizations. One of the things that I think, in terms of resources that we still need help with in Austin is, more hospitals, more psychiatric hospitals. I have had an issue where, hospitals in greater Austin are all full. And so I have to, admit a patient outside of Austin. To answer your question, Dr. Malone, absolutely. And again, it has to do with isolation. It has to do with the lack of support. And what ends up happening is if you, before the pandemic, had a baseline of depression, severe depression, baseline of severe anxiety, let's say a co-occurring substance, issue on top of that, then the pandemic happens and it's a shock to everything, and so we can imagine that that's going to exacerbate, right? Things like suicidal ideation, self-harm, suicide, things of that nature.
Exactly.
You kind of touched on this, Dr. Delpason, but so mental health has always been important.
Yes.
But what's different now versus pre-pandemic?
So I'll say this, I think what's different now, people are paying more attention. That would be what I would say. I think what's different now is that we have all spent a lot of time reflecting. We have been reflecting on the things that are most important to us. One of the things that the pandemic has done that I believe is positive, it has helped us streamline what is important and what is not. And mental health is very critical to our well-being. And I think what we're doing, for a long time, psychologists and physicians have really implemented the biopsychosocial model of care, right? So it's our physical selves, it is our mental selves, and it is our social selves. Now this is becoming something that is at the forefront. It is something that is mainstream because we recognize we are not physically healthy if we are not mentally healthy and if we don't have support. These three facets in balance create alignment, not only for us individually, but for us collectively and for us societally. So I think that's what we're recognizing now. With the pandemic, we recognize how much we need support, right? How much we need to mentally have resilience, have a sense of perspective. You know, author that I love to use in my work is Viktor Frankl, right? He survived Nazi concentration camps, a psychiatrist. The book that he's written, Man's Search for Meaning. When all choices are taken from us, we have one choice: how we respond to a given situation. So why is it important? Why is it important now? Because it's teaching us we have to be able to be mentally well in order to respond to the given changes that are happening.
Absolutely. I agree with that. If I get asked, I'm not the interviewer, but I love getting a chance to talk to a psychologist. What do you think the pandemic has done to the divorce rate?
So I actually I'm going to go ahead and Dr. Korean, go ahead and take that one. I'm going to go ahead and throw it to you. I feel like I'm monopolizing this conversation. So.
Oh, no. I think we all love hearing from you. The divorce rate specifically, I couldn't comment on that. I'm not a family psychiatrist. I know that read reports that divorce rates have gone up. But just to kind of echo and harken back on what Dr. Delpason was talking about, the difference between pre-pandemic and now, I don't think we can underscore, obviously, the economic impact of the pandemic and the stress that brings to families. But the fear of the unknown is such a challenging concept for us to wrap our heads around. So, and for so long, when the pandemic started, there was so much uncertainty and unknown about all aspects of the virus, how we could get it, what can we do to prevent getting it. I think that had a profound effect on us and has no doubt would increase anxiety. And then the other thing that I'll mention is, as human beings, we're all social creatures, and the social isolation that was necessary from social distancing to prevent the spread of COVID obviously had its impact, deleterious effects on our mental well-being. So hopefully, as we gain some sense of normalcy, as vaccinations increase and we're able to safely go out in spaces, I think that hopefully we can address some of those things. But I think you're absolutely right, Dr. Delpason. The attention that has been paid and spent on mental health is well justified. It's been coming for a long, long time.
So the American Psychological Association Stress in America studies, which they're doing more frequently now, have shown that Americans are experiencing a tremendous amount of stress. You all know this. We all know this. 31% said their mental health has worsened during the pandemic, and it's had a more pronounced effect on certain groups, particularly women and minorities. So women, 47% of mothers with children home for remote learning reported mental health, a worsening of mental health. 54% of Black respondents said they were not comfortable going back to living life like they used to before the pandemic. 78% of Hispanic adults surveyed reported undesired changes in sleep. I'm curious if all of you can speak to the specific pockets of individuals. And then after that, I'm curious if we're seeing any differences across industry. So industry, specific minority groups.
I can speak to that a little bit just in regards to women. Many of my women patients struggle with weight, and many of them struggle with weight gain this past year, and that really impacts their health, especially as many of them are already borderline overweight and borderline beyond a healthy weight. Many of them have gained 30 pounds in a year. In fact, I read an article the other day that the average woman in the United States has gained about 25 pounds in the last 12 months. That has a tremendous outsized impact on their health, both mental and physical. We all know as doctors and providers that obesity is one of the biggest risks in your physical health, but also in your mental health. And doctors, what do you say about that?
I would agree. What I wanted to speak to is a lot of my female patients, especially ones who are parents, right? Dr. Malone, you had asked about divorce. And so when we're in a single family home, right, and we've got one parent who is caregiving for 1, 2, 3 kids and working from home, the level of responsibility, the level of stress connected to the level of responsibility, because again, I mean, before the pandemic, we had childcare, right? We had resources that would allow somebody who was a single mom to be able to, you know, get their kids to daycare, then go to work. And again, that distinction between home and work was very important, or home, work, and school. You know, kids are now also, as you mentioned, Heather, the virtual learning piece is a big part of the equation. And so, yes, when I speak to my moms, especially single moms, they are incredibly overwhelmed with the amount of just responsibility, and again, lack of support, and not just, you know, from a family, kind of extended family, but more so just because, you know, daycares were closed and schools were closed. So that definitely has an impact on mental health, right? When our physical and emotional systems are overwhelmed, that, you know, that can lead to, in some ways, kind of an emotional paralysis. And so that was one of the things that we would talk about, in addition, Dr. Malone, to, you know, weight gain or lack of exercise, just because you're managing so many things. So that typical routine that you were maintaining prior to COVID has shifted, and with that comes stress.
Yeah, agree with both of you guys. I'll add, you know, even before the pandemic, as an insurance company, Blue Cross Blue Shield, we were looking at the impact of what we call social determinants of health. So that is things like where people are born, where they live, where they work, and what those impacts are on their mental and physical well-being and their ability to function. So that was important even before the pandemic. I think the pandemic only made that even worse for some of the groups that we were talking about. So that's something that we had been recognizing, we're still evaluating and looking into. And I think it's important to not look at just mental and physical health and well-being in some of those instances, but also looking at, you know, rent and do they have a safe place to live? Do they have enough to eat? Are there things that are getting in the way of diet and where they live and having enough water and access to education?
Mm-hmm. And Heather, the other question that you asked was about minorities, and specifically, you know, I want to focus on the socio-political climate in the midst of COVID as well, and what you had mentioned in the research about Black Americans, you know, really concerned about kind of readjusting. And obviously, considering the socio-political climate, we can all understand why that would be a concern, in addition to the stressors of the pandemic.
Absolutely. Are you seeing any differences across industry, or I mentioned earlier company size, where we're finding people at larger companies, which sometimes people think larger companies might have more robust healthcare benefits, including mental health care, but those folks are seeming more stressed than ever than a smaller to medium-sized company. So from the business kind of structure side of it, any thoughts there?
Heather, you might be an expert on this. You run a company, and you run a company that's about companies. So really, my personal thoughts might be that larger companies, you might be more isolated. You might be just a number or just a cubicle. But that's just my impression. Heather, what do you think?
I mean, I think that a smaller company, it's easier for leadership to kind of get deeper into it, and you might feel a little bit more connected. So, you know, same thing to your point, Mark.
Agreed. I would say accessibility to leadership happens more often, I would say, in smaller, medium-sized companies versus larger companies. And, you know, the other thing too, larger companies, unfortunately, they're thinking about overhead, they're thinking about cost. And so now that we have more of an understanding, or we're paying more attention to mental health, we're going to see more of this, you know, being embedded into other employee healthcare plans. But I think larger companies, you know, historically haven't, really put an emphasis on making sure that mental health was a part of, what they were emphasizing for their employees.
Yeah, I agree. I think that's changing. I think you guys, the piece about social connectedness is absolutely right. One of the things that I think is helpful that we've tried to implement, since we're all working from home, is trying to use webcams more so that we can all see each other's faces. And I think that helps with that social connectedness piece.
Yeah.
And the one other thing that I want to add, you're talking about pre-pandemic versus post-pandemic. One of the things pre-pandemic that was happening in my experience in the corporate realm was executives were very reactive to mental health issues. Let's say somebody just, part of their team, another leader, another executive, tragically passes away. They find out it's suicide, right? So the company reacts to a situation like that. It's almost crisis management, right? And so now I feel like with the pandemic happening, there's going to be more proactivity. How do we start the conversation? How do we explore these issues instead of getting into a reactive space, instead of, kind of scrambling to get resources, scrambling, to get psychologists within the structure to figure things out? It brings me to things like Columbine, or, these shootings that we have at high schools. If you remember initially, what would happen? We would scramble. This has never happened before. Oh my gosh, this is a crisis. Let's dispatch grief counselors. Let's figure this out. And now, unfortunately, because this happens so commonly now, there's more of an understanding. And so we know what to do. So I think that's important to emphasize.
So we've talked a lot about stats and stress numbers and whatnot, but what are companies doing to help their employees right now? How are companies helping their employees manage what's been going on the past 15 months?
I can speak to that a little bit. As soon as vaccines were available, we applied and received some, and we got everyone vaccinated at our company. And then we encouraged everyone to come back to work physically who could, and almost everybody did. And I think that really had a great impact on the morale and productivity. Again, some people work better at home, but by and large, most of our people would rather come to work physically and participate in that synergy of a busy office or a busy workplace. And those of us who are patient-facing, they love to see their patients in person, and that's what we're doing. 95% of our patient visits are in person, and we feel confident because we've been vaccinated, and we wear our face masks anyway out of courtesy to anyone who is not vaccinated. and of course we wear gloves, and we limit how many people can be in a room and how many people can be in the waiting room and so forth. But I think getting back to normal is our best defense, getting back to the workplace, getting back to activities. I believe strongly that the virus is bad enough, but the collateral damage is much worse. And the collateral damage starts with shutdowns and staying at home and the economic impact of all of that, but even more so the psychological impact of all of that.
I would add, I think as employers, it's imperative for us to increase mental health awareness. And I think panels and sessions just like this are a great way to do that, to increase awareness. But I think we can also make employees aware about programs such as EAP, Employee Assistance Program, and be mindful about taking PTO. As Americans, I think that we're reluctant to take time off to begin with compared to other nations. And we weren't the best at doing that pre-pandemic. And I know since the pandemic, a lot of family vacations and time off has been killed, but we have to remind ourselves of the importance of taking time off for both our mental and physical well-being.
Absolutely. I would say in our society, especially within the corporate realm, we have a convoluted relationship with rest, right? So we think rest, a lot of us think we're not being productive. We shame ourselves, we punish ourselves, for watching Netflix or for reading a book, or, for taking a step away from our computers now that we don't have that clear, distinction between home and work. So I think we really need to consider what is rest, right? What is productivity? We need to really look at redefining these things, because our society, historically is fast paced. And for a lot of us, if we take a break, we sometimes fall back into thinking that's complacent or that's lazy, right? But rest is necessary, mental rest, physical rest, right? All of that, social rest, all of that is necessary.
I think that's very true.
Tell us a little bit about what businesses can do in terms of their healthcare plans, and are there any changes they should be making? We had a question from the audience that phrased it like this, which is great. In what ways is the pandemic and an increase in use of mental health care an opportunity to invite employers to assess the mental health insurance coverage that they offer their employees?
Yeah, I'll take a stab at that. I think it is a great opportunity, especially to visit plans and policies about telehealth. Telehealth is not a flash in the pan. The genie's out of the bottle, so to speak. And I think this is a great opportunity, as some of the panelists have mentioned, for us to expand our reach for mental health care and visits. So if that's a question that you guys have, feel free to call your insurer. If your insurer is Blue Cross Blue Shield and you want to know more about your telehealth coverage, give us a call. We'd be happy to answer any questions you guys might have about that. You want to avoid, obviously, surprise billing and surprise visits. So those are some important questions to ask.
And I do believe that telehealth was actually covered, as a result of the pandemic, and then it just expired. So now we're, I think, trying to get that started again. Is that correct? In terms of insurance, in terms of reimbursement for insurance, yes.
So CMS expanded coverage, and I know I can't speak to other payers, but I know Blue Cross Blue Shield has responded in kind and followed the path of CMS.
Dr. Delpazon, there was a specific question that asked if you think telehealth works better with or without video, which I thought was interesting.
It's really interesting because I do have a portion of my patients who like phone sessions, and because I have built a long-standing rapport with them, they were patients that I started working with, prior to the pandemic. I'm okay with that. But I will say this, I will say that, one of my policies, if I am initiating care, I require that my patients meet with me through video, right? Because I want to be able to, observe them and also create rapport. And that's hard when you're doing it for the first time over the phone. And the other thing I'll say is this, this was really an interesting thing that I came across through using telepsychology, through the pandemic for my younger age patients, right? So adolescents and young adults. Before they would come into my office and they would say, Dr. Delpazon, my dog is amazing. My dog is such a support for me, or my grandma is amazing. I wish you could meet her. She's such a support. And so now with telehealth, when I meet with them, I get to see Sparky on the screen, and I get to be introduced to their dog, and I get to meet grandma. And my younger patients will point to posters on their wall, and that's how we build rapport. This is the new world that we're in, and it is very beautiful for me to be, in their homes and with their families if they choose to include, extended members of the family in our sessions. There's a different kind of connection. I think we're all, afraid of what happens in a virtual world. But I will say this, I have really actually been able to see connection redefined. And for that, again, I'm excited.
So we used to pretty much work at the office and live at our houses. Then we started to do the work from home thing. And now, quite frankly, I mean, we're basically living at work, right? I mean, I work different hours than I've ever worked. I mean, it's just all over the place. So how does this look as companies and individuals navigate heading back into the office? That's really what people are talking about right now. Our company had a call yesterday to talk about the fact that, you know, we have the ability to go into the office, but as far as a real firm program, it's probably going to be around Labor Day. So what kind of things should employers be doing or be aware of for when their employees re-enter the workplace specifically?
I would say a lot of communication. I think, like we talked about, you know, with the pandemic and the level of unpredictability, I think communication is key. I think that, you know, as we all are observing, making it a gradual process. I think doing a needs assessment and asking employees what's been working, right? What hasn't been working. One of the things that I want to emphasize, it's very important as we're thinking about coming back to ask what hasn't been working, right? It's better to get a to-do list of what, or not to-do list, so to speak, what doesn't work, so that we can really be able to identify the solutions moving forward. So I think a gradual process, I think a lot of communication, and I think, you know, getting the pulse on our employees. How has this experience been for you? Again, what's been positive, what's been negative? How can we cultivate, you know, an environment that you want to come back to?
Right. As an employer myself, as we have almost 500 employees, and I can tell you our experience is that some people thrive at home and are happy and even more productive, but others are not happy and are not very productive. It can be quite depressing at home, sitting at the dining room table with your laptop with no one to talk to. And those people are ready to come back to work. The ones that love it at home, though, are hoping they don't have to come back to work. So it's a brave new world out there. Things are changing rapidly. I think employers are going to have to look at metrics, you know, measuring performance at home, maybe measuring attitudes and happiness at home. I don't know how, I know there's a lot of ways to measure those things. But it's going to be a mixed bag, and I think that's good. Overall, it's good because people who want to work at home can do so, and people who want to work at the office, hopefully they can still do that. So things are changing, and I hope for the better.
Yeah.
Well, the other thing too is, go ahead. I'm so sorry.
Oh, that's okay. I was just gonna to add on to what you guys both were saying. Measurement is a key and essential. I think making sure that people feel comfortable coming back into the office. So at Blue Cross, we've got a return to office committee who specializes in doing just that. So clear and communication. Here's the process. We're gonna do temperature checks at the door. Just making sure employees feel safe before they come back into the office. The other thing that we're doing is we're trying to, you know, we're not requiring vaccinations, but incentivizing folks to get vaccinations before they return to the office as well.
Absolutely.
Yeah, I think it needs to be more of a tailored approach, right? Not a one size fits all. And I think, you know, because we've learned to be more flexible, that oftentimes the hybrid model, you know, not for every domain, the hybrid model can be actually very beneficial for optimizing people's stamina and energy and mood when it comes to work.
Mm-hmm.
Absolutely.
I think all of this really is going to play into recruitment and retention of employees as well, right?
Yeah.
So I had a question from the audience. What companies, do you have any examples, maybe have best practices regarding encouraging employees to invest in mental health care and wellness?
I would say a lot of, go ahead, Dr. Malone.
I was going to put that back on you, Heather, because you know a lot of companies, but go ahead, panel.
No, go please, Heather, go ahead.
Oh, I was just going to say, we do our Best Places to Work program every year. So we know that a lot of those firms, you know, are considered best places to work, and that tends to be because they're engaged employees and they have often will read about the benefits that they have, and that includes things like mental health. We're just doing that program for this year which basically when you're surveying all the employees, we're just getting these results back. So I don't really have any hard data for you, but it was interesting to see that after the year we had in 2020, after the last 15 months that we've had, we still had just as many employees and employers participate in the Best Places to Work program. So I think it says a lot about companies, stepping up to help their employees during this time. So we'll see. That will probably a lot in some of the comments that we'll read as we go into that program this summer.
Great.
So I mentioned this before, but do you think there are any differences in Austin compared to the rest of Texas, or compared to the rest of the country, as far as how, I don't know, how mental wellness in the workplace either has been affected by this pandemic, how people's mental states are, how companies are dealing with everything?
You guys don't want to hear from the perspective of a Dallasite, so I'm going to let the Austinites answer that question.
How about we start with you, Dr. Malone, and then we'll go around.
All right, just my personal experience. I have some friends and colleagues on the West Coast, in fact, in San Francisco. I was just talking with them. It's really quite shut down out there still. People are still wearing face masks everywhere. It's mandatory, of course, and most people are working from home. It's much more open here in Austin. Of course, face masks are still everywhere, but not mandatory like they used to be. More people are going out in the evenings now, I've noticed. Restaurants are back to close to capacity, it looks like. You have to wait at the door at a lot of places. I feel like we're more open, we're more advanced in putting the pandemic behind us than other places are. That's just our optimism, I think, and maybe our Wild West frontier spirit. But I think we're pretty advanced in moving past the pandemic compared to other places. And that impacts our attitude and our optimism. That's just my perspective.
I would say from my experience, especially right now, I'm really, my Austin patients are very hopeful, very optimistic, and very resilient. And a lot of the patients that I work with, they recognize this time not only one of adversity and one of difficulty, but also one of opportunity. And we talk a lot about the opportunity for gratitude. We talk a lot about the opportunity for change and what these changes can bring about, not only individually, but also for our society. I think a lot of this optimism comes from a younger population who is very progressive in thought. In Austin, also, we see an influx of companies moving, from the West Coast to Austin, and they are also bringing innovative ideas. And, that to me really makes Austin different in terms of, again, from my vantage point at least, in terms of mental health.
So, well, we won't make you step in since you're living up there in Dallas, right, Dr. Kurian?
Yeah, no, I can maybe from a Texas perspective, I agree with both of those.
Sure.
And I think we do have more of a free spirit and a free nature here in Texas. And the other advantage that I'd say is the outdoor space that we have in a lot of our bigger cities, like in Austin and in Dallas, where it maybe make people feel more comfortable getting outdoors. Just sunlight in general is beneficial for our mental health. So we don't have the disadvantage of places like Portland or Seattle, where they suffer from seasonal affective disorder. So getting outside, feeling more comfortable, I think are all important things.
Absolutely.
So we talk a lot about what we've lost in the past 15 months, and I'd like to hear what you think we've gained What are the silver linings? Speaking of optimism, like what's going to stick and what should stick as we kind of venture back into the world?
Well, I think commercial real estate is going to be a lot less expensive. So that's a positive unless you're in the business of commercial real estate. I think flexibility, we're going to have a lot more flexibility in society in general, especially in regards to workplace, working at home or working at the office. That's going to be a huge change. Yeah, I think we've all thought about what's important in life, and I think mental health, like we talked about earlier, has become much bigger topic and a bigger concern. So I think a lot of awareness I think we're benefiting from a lot more awareness in the mental health world.
I would say innovation. I would say patience. A lot of the things that maybe once bothered us pre-pandemic don't seem to, again, when I have conversations with a lot of my patients, don't seem to be as palpable as they once were, and that's a good thing. Again, I think resilience, I think adaptability, I think agility. You know, if there's one word I want to use that I think will stick because of the pandemic, it's agility, emotional agility, being able to recognize how we feel, being able to respond in a way that's conducive to well-being. And also, again, a part of that is gratitude. So many of the people I work with, it's like, wow, I miss, you know, travel. I miss kind of all those little things that I wouldn't even, you know, pay attention to. And now it is something that I can't wait to do. And I think all of that is so important for growth, right? I mean, we don't grow unless there's adversity. We don't make meaning out of a situation unless it's hard. Human beings need to be challenged in order to sustain a sense of mastery. And while this has been a very challenging experience, we are all learning about self-efficacy and a sense of mastery in a way that I think won't change. It'll only continue to be fostered.
Wow, really well said. I hate to even add anything else to that, but only thing I'll say is, as a father of 2 adolescent boys, it's been amazing to me. You know, I've been looking at this from the prism of, boy, what a lost year for them. They weren't able to play basketball. We missed a lot of the school year being in person after the pandemic. But, you know, more recently, I've been looking at it from the other side and how much they've gained. The word you said, Dr. Delpasan, resiliency. I think this generation is going to be a much more resilient generation for having to go through these obstacles and hardships and then being able to come out through it on the other side.
Absolutely.
We have about 5 more minutes, and so I kind of want to end today with just asking you each, what are your top tips for employers right now, and for managers about how they can help with mental health in the workplace? You know, what can they do right now? Maybe a tip for right now. What can they do in 3 months, and what can they do in 6 months? And any tips, some actionable things that folks today can do as an employee.
So I would say this. I know that we all, you know, in the business world, we like objectives. We like an A, B, and C. You know, we want things to be efficient. You know, Heather, I think one of the things with mental health is that this needs to be a long-standing relationship, right? So the first thing that I would say is it's really important for employers to do a needs assessment. Really gauge, again, what your employees need, right? And then also what hasn't worked. Instead of thinking initially about solutions and what we need to do, we need to look at it from the opposite side, which is what have we not done or what has not worked? Because that's how you do, you know, a real exploration, and then you come up with solutions that are tailored to your organization. right? And so when we talk about a mental health culture, that is not something that happens overnight. Dialogue needs to happen every single day. It needs to be embedded in meetings, in conversations with mentees, with mentors, with leaders. And to executives out there, one of the things I want to say is you don't have to have all the answers, right? I think a lot of times when we're in a position of leadership, there is pressure to have all the answers. And we connect that to competency. We connect that to having to know, right? If we're going to lead, we have to know. We need to collaborate with our teams, with our employees, because they understand things and they see things that we don't. So that collaboration is essential in terms of embedding a mental health culture. And I would say being proactive using these means instead of reactive, right? So when you have these embedded protocols in place, the system gets comfortable, the system understands it, there's a level of predictability. The last thing I'll say is modeling. A lot of times, again, executives worry about modeling, and I use this word, and a lot of my patients roll their eyes, vulnerability, oh, that's cliche, therapists use that word, but modeling honesty about struggles that you're having, because that opens up, the dialogue for other people to say, wow, you're struggling with that? I am too. Instead of us acting so stoic and acting like nothing is affecting us, nothing is happening personally that may be affecting us professionally. So that stoicism traditionally that we see in the corporate realm, we really need to dismantle that if we're going to have a, sustainable culture of mental health, mental awareness, and mental well-being.
Thank you. Dr. Malone.
Well, that was very well said. I hate to follow that, but I have had 2 cups of coffee, so I'm happy to jump in there. What I can say is what I've learned and what I think many of my colleagues have learned is it's important to separate work from family or work from home. And when you're working from home, it gets blurred so easily. I know personally I've been on email and text messages, sometimes late, all the way up to bedtime and beyond. And that's terrible for family life. It's terrible for your marriage. It's terrible in a lot of ways. Many of my colleagues, the people I work with every day, are in that same boat. Many of my people are patient focused and see patients or support patients through scheduling or computer work or whatever from 8 to 5 every day. And then at 5 o'clock is when the email starts. That's when you catch up with all of the business behind the scenes and emails and text messages. And sometimes we're meeting after hours. Sometimes it's a happy hour, but all we talk about is work. So really, we need to learn to separate work from home life.
Mm-hmm. Yeah, and employers can do that by making it okay and communicating that we're not going to email after a certain time. I need to do that more. I do know I need to do that more. How about you, Dr. Kurian?
Yeah, no, both of you guys well said. Only other thing that I'll add is like we said, the importance of taking time off, but then also the importance of being respectful and mindful of your time off. So when somebody's out, not bothering them with vacation or request during that time. But well said, both of you guys. I have nothing else really to add.
Ultimately, it's about practicing what you preach, right? So if we're going to make this culture, then we have to make sure we're modeling it, because if we're saying we want self-care and we want, mental health to be embedded in our structure organizationally, and then we don't abide by that, well, we have to be consistent.
Absolutely. May be Mental Health Awareness Month, but that doesn't mean that mental health awareness stops in May. So Be mindful of it absolutely year round.
Exactly.
That's a great way to end things. So it's been an extraordinary 15 months that we've been living through, and it's had an extraordinary impact on all of our mental health. I want to thank all of you, our panelists today, Dr. Malone of Advanced Pain Care, Dr. Delpasan, founder of Respire Consulting, and Dr. Ben Kurian with HCSC and Blue Cross Blue Shield. As an attendee, you'll receive the video link today, and the best of the conversation is going to be turned into some content that you'll see on Austin Business Journal's website and in our weekly print edition. So be sure to take a look at that. I also know I've been getting some questions throughout. I tried to get some of those answered for you, but there's also some really good questions. I'm going to see if our esteemed panelists, if I send these to them, if they might consider jumping on to some answers for those, and we'll get those out to all of the attendees. So thank you for joining us today. I really appreciate it. I can't wait until we can do something like this in person. And to Dr. Kurian's point, I mean, this is obviously something that should not be a one and done conversation. I hope that we are talking continually about mental health in the workplace.
Absolutely.
Absolutely. Thank you, Heather.
Thank you all.
Thanks, everybody.
Bye-bye.
Bye-bye.